Panoka, followed by Dunvegan and Central Peace Notley.
Thank you, Mr. Speaker. Alberta is home to 36,000 registered nurses who have been trying to convince the government for over 5 years to grant them limited prescribing authority. These are some of the most skilled and dedicated health professionals in the province who would be able to provide first-line treatment for common conditions where the antibiotics or other Schedule I drugs would be required. Making these regulatory changes would allow better access to care and would mean less burden on local rural health centres and emergency departments. To the Health Minister, other health professionals have been empowered with expanded scopes of practice. Why not Alberta's highly skilled registered nurses?
Mr. Speaker, we much appreciate the question by the honourable member. Matter of fact, I was meeting on that last night, and it's going through the process. Unfortunately, it's a two-sided coin. The nurses are not as quick, we're not that quick, and this system has not moved as near as fast as we would like to see it move. So we're in the process of trying to encourage everybody to move along the line so we can get the nurses to do the kind of things that they've asked for in the bill. We're in strong support of this.
First supplemental.
Given that many of the rural communities across the province have RNs working in emergency departments, often without physicians and nurse practitioners present at all times, and given that rural and remote emergency departments often require registered nurses to act immediately to treat life-threatening patient conditions, why won't the government provide limited prescribing powers to these highly trained nurses so that delays can be prevented and lives can be saved?
Honourable Minister.
Yeah, Mr. Speaker, as I've said before, this is a process that goes to legislation. It has to go through approval. A variety of people have to review it, not just the government, but those nurses, other individuals who are part of the process, and unfortunately it takes too long. I would like to see this whole procedure go very quickly, and I was quite surprised that it's been, I think, since 2011 we've been working on this one. There is a need for the nurse to be able to prescribe the necessary medication in rural areas, but right now we haven't got that completed. We look forward to move it quickly. I do thank you for the question.
Thank you. Final supplemental.
Mr. Speaker, the nurses have been working on this with the government for over 5 years now. Given that the government has rewritten regulations related to the scopes of practice for Alberta's 12,000 LPNs, 4,500 pharmacists, and even the dozen or so physician assistants, really, they're all good moves, by the way, but at the same time, the government has ignored the 36,000 registered nurses across this province who could be utilized more effectively. To reiterate, it's been 5 years they've been working on this. Will the minister commit to working with CARNA to complete the regulation drafting process by the spring of 2015?
Honourable Minister.
Thank you, Mr. Speaker. I would encourage a member to call CARNA up and tell them to move through the process as quick as they can. We will move as quick as we can. We'll get this approved. It's an important step, and we would encourage everybody to make a phone call, get it done. We'll move quickly.